it now. All right. Welcome, everyone. Thank you for being here today to our March Connecting the Dots meeting. It's great to see such an awesome group of folks joining to learn more from one another and to share your own knowledge and updates. I'm going to go ahead and share my screen so we can take a look at the agenda for today. And so I can spend a few minutes going through some updates on our end. And thank you, Emily, for keeping an eye on the waiting room here and admitting folks as we move through the meeting. So here is our agenda. We'll spend the first few minutes getting grounded as we have already. And thank you for introducing yourself in the chat. If you're just joining us, please do that. And I will spend the next few minutes giving an update from the MSBC. And then we will have the remaining part of the meeting. I actually didn't update this, but we generally aren't doing the wrap up so much as we are going until 1 o'clock to do updates. So, and sharing. And so that's an opportunity for you to introduce yourself further and your organization, and also share anything you know legislatively. I do see that Sarah Tui is here. Thank you. We should be able to get to your doula legislation updates before you have to leave. And then anything else that is going on in Maine that you would like to share, some updates that you have, if you have learned of any other continuing education opportunities, if there's any research that you've heard about that you want to share, and if there's anything that's coming up in your workplace or in the families that you're working with that you want to bring up to the group, looking for some suggestions, that is our opportunity here today. We have an opportunity for that today. So some updates from us. Again, if you join our meetings, you know that we like to start off sharing that we have a number of different committees that are always looking for volunteers. So if you are interested in advocacy or event planning, we have our Patchwork of Parenthood event coming up that we have some dedicated volunteers helping to plan and always looking for more folks, especially as we get closer. And fundraising, always looking for folks to help with fundraising. It could be one little fundraiser that you're willing to take on to support the Maine State Breastfeeding Coalition, or joining our committee to help us think more deeply about what we can do for fundraising. We welcome any and all support around that, because we thankfully, in some ways, don't receive federal funding. You know, that is not, we don't have that threat right now of federal funding being taken away from us. We also don't receive state funding at this time, and that is something that I think a lot of people assume. We are a state-funded organization, and we are not. We are really funded thanks to annual sponsors and thanks to some donations that we receive from folks at this point. So we're always looking for more ways to sustain our organization through either, again, fundraising, and we have some opportunities here that you can see, and also through time. So if you're just by donating your time, by being part of one of these committees or offering help with some tasks, or joining our board, those are all ways that you can contribute and help us sustain our organization. So we also have our workplace committee that is meeting quarterly right now, and that is focused on reviewing recognition program applications and any other updates that come up along with our toolkits. We're continuing to work on workplace support for sure. That will always be the case. We also have our DEI committee, and I'm not sure if we have any members from that committee joining us right now. I know Petrichor couldn't make it today, but they are about to start reading the book, I'm Not the Mother. Is that what it's called? Oh gosh. And they're going to be reviewing scholarship applications as well. So that is something that you could be a part of if you're interested. Our communications committee is focused on our website and social media and newsletters and all sorts of things. Communication committee is very busy and a rock star of a committee. So if you're interested in joining that, we'd be happy to have you as well. Our professional development committee is working on our educational webinar series, and we have some really exciting webinars coming up this year that we'll be sharing soon. And also working on CEs. So if you are an RN, and you were interested in volunteering with the MSBC, we would love your time and support to help review applications we have to put out to a couple of different organizations in order to get continuing education, which I know a lot of you here would love to have for our webinars and our upcoming conference in the fall. And that is our other planning committee as well. Our other committee is our conference planning committee. So I'd be happy to have you a part of any of that. And the link for that to sign up to join a committee or just to volunteer is there. Again, we have these donating opportunities here. We want to thank our annual partners, specifically our advocates who are at the higher level, thanking them for helping to support our organization throughout the year. We also want to thank all of you who are IBCLCs. Yesterday was IBCLC Day, and we just want to give a shout out. If you are an IBCLC and you haven't already introduced yourself as that in the chat, don't hesitate to just call yourself out and say, I am an IBCLC. You've worked really hard to get there, and we want to recognize you and all the work you do every day to support families. This also has some continuing education resources listed. USLCA has recorded webinars all the time. I also didn't get a chance to add to the chat, but Breastfeed LA, I think I've shared before, also has some fantastic webinars coming up. This is also a document that hopefully it's already been shared in the chat, but this document is a living document that you are all able to edit. So if there is a continuing education opportunity you'd like to share, feel free to do that in the chat and when you have a chance to share out loud. But you can also share that by copying and pasting into this document for folks to have reference to. I want to share this webinar or this training that starts tomorrow. It's a two-part training that is being offered through the Maine Coalition to End Domestic Violence. And this looks like a really great opportunity to learn more about that. And so it's being put out through the Community Doulas and Maine Doula Coalition as well, but it is really for anyone who's working with new families. Also wanted to let you know we often have new blog posts, so to keep up on our blog, the latest ones are on pelvic floor health, and there was one on milk donations. Always reminding you of our LGBTQIA2S+ resource for professionals. It's on our website to download. And Zip Milk, again, if you haven't already submitted your listing, if you are a breastfeeding counselor or educator, if you offer free breastfeeding support, if you are an IBCLC or a medical professional that supports lactation, if you offer a support group or you're a WIC breastfeeding coordinator, please add your listing. We want to make sure that's really populated. And then resources that you've probably already heard about, but want to remind you about our Zip Milk directory, about our support group directory on our website, and also our Returning to Work Employee Toolkit has been translated into 4 other languages. We're really excited about that. Those are all on our website to download. So please check that out and share that around. We also have postcards that are not printed yet, but I know that they have been designed. And we will have updated postcards for our toolkits and postcards in these other languages to promote those toolkits as well. And then as far as legislative updates, I may have mentioned this before, we'll have more information coming, but their LD 865 has been published now. It is called an act to require Maine Care to reimburse for lactation services in the homes of eligible persons is the title. The language is the link that's underneath. We are asking the sponsor to make 1 or 2 amendments before it is heard at the public hearing, and that is to expand where those services are provided. And right now, this is also specific to IBCLC support. At some point, we can consider looping in CLCs. This has all happened rather quickly. And Mitchell, I hope, is here today to share a little bit more about that. As she has really been leading this effort. So we want to hopefully hear from her in a bit. Paid leave, there are always updates happening with paid leave, and you can find those updates on the websites listed here. As you probably know, 2025 is when contributions are happening, and as of May 26th, that's when people can start receiving the funds for paid leave. Sarah, again, I think we want to make sure you have time to share more about the doula bill as well, but that is also published, LD 376. Um, you can learn more about that through that link. And there is going to be the Doula Advocacy Day at the State House on March 27th on a Thursday if you want to go support doulas and the legislation for Medicaid reimbursement. Milk banks are always looking for donor milk, so we want to make sure that's not forgotten. We have our Patchwork of Parenthood event coming up May 17th in Brunswick and are still receiving submissions. The deadline for that is March 17th. So we still have a couple of weeks. If you yourself are interested in telling a story, sharing a story on stage, a 10-minute story, or if you know anyone that you work with who has a story. We all have stories, but there's some people who are just really especially skilled at telling and sharing stories. And we also will have a writer who helps people develop their stories if they need some support around that. So if there's someone who's like, "Oh, I don't really know if that's me," know that we will offer support if they're selected. So, but before March 17th, we just ask that 250 words are submitted or a 2-minute audio. We really find the audio recording especially helpful if that's possible. But that information is all in our newsletters as well. If you're not receiving our newsletters, please mention that in the chat or send me a message and we'll be sure to add you to our newsletter list. And then we have our annual conference coming up September 17th. We have a few speakers lined up for that and we're looking for more. So if you have a proposal you would like to share, um, that would be a topic that would be something that would be of interest to basically anyone who's here in the meeting today. You know, we've got WIC peer counselors, we have doulas, we have lactation consultants, we have nurses, and Maine families home visitors. We're trying to create a well-rounded agenda for folks who can appreciate all of the topics. So we always welcome speaker proposals. Those are the dates for our webinars. Again, we'll send more about info about what those topics are. We're really excited. And workplace support again, if you have any job opportunities you know about that you would like to put in here or send me to include in newsletters, please feel free. And then strategic planning. You've seen some emails hopefully come through about this. We have our survey that we are accepting tomorrow. Actually, might be the deadline, the soft deadline for our survey responses. And our focus groups are scheduled for these are for those of you who are working with families. We really want to hear more from you. We figured we wanted, knowing that we have meetings of 36 people sometimes, we wanted to have separate focus groups of 10 people or less to really talk through what you think the challenges are and the barriers are for families, how you think the MSBC can better support families with their infant feeding goals. So if you can attend any of those dates, please sign up and I would love to see you there. They're all going to be virtual. And then in the meantime, I'm connecting with parent groups in person to receive their input. So we want to hear from as many people as possible. And then those are our last Connecting the Dots meetings of the year. Thank you for hearing all of that and for hanging in there. I'm going to scroll back up to this section here so we can copy and paste this for the chat box so you can see again what this next part of our meeting is going to be focused on. And we've tried different strategies in the past where I've called on people in order. And we've also done it where people simply raise their hands or unmute and share. And I think with a group this size, we're going to have to go with that. And I might actually call on some folks like Sarah, knowing that Sarah needs to leave earlier. I will open it up to Sarah to share more about doulas, and then I hope that you all can be ready to share something next. And if you can use the raise hand function, that would be fantastic. That can be found under the React button, I believe. Yeah, but Sarah, go ahead, take it away.
Hi, everybody. My name is Sarah Tui. I'm the chair of the Maine Doula Coalition, and I am a doula up on Mount Lizard Island in Hancock County. I'm also an acupuncturist, and I'm sorry if I'm a little bit echoey. I'm in one of my offices right now. The Maine Doula Coalition has been sort of in an expert opinion and advisory role as the state moves towards putting Maine care coverage of doula services into place. So we have been advising a group called the Doula Legislative Access Team that was organized through the Maine Women's Lobby. We've been working since the summer in that capacity. There was LD 376 just came out, which is a bill um, that was put out by Denise Tepler. That bill honestly was a little bit of a surprise to us. So there's that bill that has come out of the revisor's office. And then there is going to be a second bill coming out of the revisor's office at some point. We don't know when, by Representative Decca DeLocke. And Representative DeLocke was working with the Maine Women's Lobby as part of this access team. So it looks like there are potentially going to be two bills for reimbursement of doula services. I don't know with the way the legislature is this session. I try and stay out of it and just kind of stay in an advisory and expert opinion place. But I know with the way the legislature is this session, I think anybody who's has a bill that potentially has a fiscal note and funding attached to it is, I think we're all feeling like we don't really know what's going to happen. So that is where we are at with doula legislation. I was also on a meeting yesterday, the Perinatal Systems of Care Working Group meeting. As many of you know, Maine was awarded a TIMA, or Transforming Maternal Healthcare grant, a large 10-year, $17 million federal grant on January 6th. Maggie Jansen, who's one of the people who's in charge of that grant, gave an update yesterday, and it looks like that grant, for the time being, is still sort of rolling along. So that grant does require the state to cover doulas by the end of year 3 of the grant. So that's the end of 2027. So that's also happening in tandem to legislation. I wish I had more specifics, but everything is very much up in the air at this point.
Okay, thanks, Sarah. I feel like I had heard something about the two doula bills being merged at some point, or like, can you say more about what's happening there? Because I realized the one that I put in the notes was the one that wasn't the original
Yeah, and it's
bill.
great. It's great. It's a very simple and well written bill. And I don't honestly know. I think what I'm told is that these conversations between legislators happen in 10-minute breaks between sessions. And there's probably people on this call who are way more familiar with how all of this works than I do. But really, it's up to legislators at this point to figure out how they want to merge or work together, or pull a bill back or push a bill forward. And so the Doula Coalition is really in a place of trying to make sure that the people that are making decisions about this have evidence-based information from the workforce assessment, and that we're making sure that the voices of doulas, and really anybody who's providing care to our families in Maine welcoming new babies, that all of us have a voice at the table in terms of making sure that there is expert opinion available when decisions need to be made. So,
Yeah,
yeah,
excellent.
yeah. I wish I knew more.
Yeah, it is. It's a
It's all a
process.
little, I attend births, and so I do exciting things, and this is a little bit too much excitement for me. So,
It's a lot. It's like a fast-moving train, really, legislation once, and there's a lot to learn. And yeah, so we're kind of along the same ride with the lactation bill. Mitchell, would you like to share a bit more about what's happening there?
Yeah, I totally can. So, I'm joined on two separate things. One so people can actually see me, and one so I can actually hear things because my computer is not working for sound. So We officially have the bill. It unfortunately just states, I believe, in the hospital and home settings currently. We had a little bit of miscommunication on getting that wording out there. So we are working on getting that changed through an amendment before it finalizes. The other thing is we were trying to figure out how to incorporate everybody. What wound up happening is currently it's just for IBCLCs, and we will at a later date be able to hopefully expand that. The problem was we started this, I don't know, Kara, we started this in November, maybe even the end of December. We had to have everything in by like January 10th. So it moved really, really fast from like an idea to fruition and being an actual like tangible thing. Right now, we're working with the director of WIC, and she is working with the finance people to try to give them the information that is needed to do the financing. So, one of the confusions was, but Maine Care already pays for IBCLCs. And yes, they do. Maine Care does pay for in hospital IBCLCs who are working with a provider. However, for private practice IBCLCs, we're not able to even go to Maine Care and say, hey, I want to be able to accept these patients. They basically have said, no, Mitchell, you cannot even be in our system to accept those patients without a provider doing it. So that's what this bill is going to do. It's going to really allow, private practice to actually get referrals and see Maine Care patients without any financial burden on those families. The other hope is that with this bill, we can get more families out to IBCLCs when they need that. As you know, if you are a CLC, it's a great stepping stone, but sometimes things are a little bit more complicated and it does need to be escalated to an IBCLC. And this would give everybody the opportunity to escalate that without having to worry about the patient's ability to pay.
Awesome. I don't know if you Okay. Um, the other thing that we're so the Maine State Breastfeeding Coalition's role right now too is to provide education and information and to support Mitchell in her advocacy process as well. And so the fiscal note is the next piece that comes with this, and that is the part, as Mitchell mentioned, we're trying to give information to, and they had asked WIC to help with that. So we also know that there are people can still access IBCLCs outside the hospital through WIC, through public health nursing, through Maine Families possibly. But we know that um, that there are more IBCLCs out there who would like to be able to see these patients and be able to maintain a practice by being able to get reimbursed for their time. So we're still we haven't done an official or formal workforce assessment like the doulas have. But if you here happen to know, we know that WIC has 5 IBCLCs throughout the state. If anyone here knows how many IBCLCs there are in public health nursing, how many IBCLCs there are in Maine Families and like in other programs where they are seeing families, that would be really helpful information to have. We're also, and if you are a private practice IBCLC who hasn't already connected with us or isn't listed on Zip Milk, then that is really good information for us to have as well. We do have a list of, I think, what is it, Mitchell, maybe 15 or so who are private practice throughout the state. But according to the IBLCE listing, there are 93 IBCLCs in Maine. And some of those may be retired and not practicing, but we want to better understand who they all are. All right. Any other questions about that, about legislation or anything related to that? Feel free to ask in chat or unmute. Otherwise, we can switch gears and again, open it up to anyone who has anything that they'd like to share or ask this awesome group. Sarah. Oh, you're on mute, Sarah.
I have one more thing that I wanted to share before I go, and that's that I was alerted by, I don't think anybody on here is a birth certificate certifier. I don't see midwives uh, on here, but yesterday there was an email sent out from DHHS saying that the enumeration at birth program is being suspended. And I don't know that what that means is that there's a little box on the birth certificate paperwork that parents can check that says that, yes, I want my baby to have a social security card and a social security number. That information then gets automatically sent to the social security office, and parents don't need to go to the social security office in order to get a social security number and card for their baby, which is great. So there were midwives yesterday who alerted me to the fact that they received an email that that program has been suspended. And so parents are going to need to go to the Social Security office. And I don't know when this was started. I don't have a lot of details. I'm not a birth certifier for the state. But because there's so many people on this call that are working with families that are having babies, I wanted to share that information. I encourage you to like reach out to higher ups, other people to get more information. But I think that this is something that those of us who are doulas and CLCs and IBCLCs and public health nurses, I think it's something that everybody should be aware of and start asking questions about. So that we can make sure that all of the families that we work with know about this. They know, and I don't know how long it's going to last. This is, one of those situations where wait 5 minutes and it'll change. But I think it's something that all of us should know about so that we can make sure that our families have the resources, the transportation, the interpreters, all the things that they may need in order to go to the office to make sure that their babies can get a Social Security card number. So I know that's like a bomb. I don't know if I just dropped a bomb on it. It's a big deal. There's a lot of implications. But I wanted to share that quickly with this group. And again, I did not receive this email. I was forwarded it and I have verified it. It appears to be it's a real thing that's happening. So other people may have more information. And now I actually have to go because I have patients. But I just wanted to let people know about that.
Thank you so much, Sarah.
Yeah.
All right. Yeah. So Michelle saying thank you. This is very pertinent to WIC families. So yeah, if anyone finds any information about this that it would be good for us to share out, please let me know, and I'm happy to put that in our next newsletter. And anything that you find that you think would be good for everyone in the Maine State Breastfeeding Coalition to know about, I'm happy to put in newsletters. If it's a local event, we tend to share those through social media. But if it's something that would apply statewide, then we're happy to share that. Who else has something to share or ask? You're all doing such awesome work every day, so I know that there is great work to share, so don't be shy.
I'm driving, so I can't see if anybody's hand is raised, but if not, I have some things I could share.
Great. Thank you, Maddie.
Hi guys, I'm Maddie. I am a RN in CLC with the City of Portland Maternal Child Health under the Block 5 grant. I think I saw when I was pulled over earlier that there was a lot of people in public health nursing here, so this is probably not new news to everybody, but just wanted to give people a heads up. The City of Portland team is being dissolved due to some funding changes. And this is a team that has been around for over 50 years. Our team has cumulatively like 80 years of experience. Nurses have been on the team for 27 years independently, and then some of us are a little bit newer. So it's a really, 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 really devastating loss for the city, especially because we do have such a specific population here, not represented across the whole state. The good thing is that there supposedly will not be a gap in care. People should be able to still get a public health nurse from the state nursing team. That being said, we have been told that people are waiting for a couple of weeks to get a phone call, let alone a visit. So if anybody has more updated information, that would be welcome. But like I said, going from really, really fully staffed team of 5 and lots of experience to 0 is a big loss, as is just the community engagement that we've built through all of these decades and the connection. So, yeah, for more information, the City of Portland Maternal Health website has my supervisor Marianne's email on it if anyone has like specific questions, or you can DM me. Um, and thank you to the public health nurses and the rest of the state for covering our beautiful families. And yeah, we will be out of here. Our contract ends tomorrow. So this is present happening right now. Yeah, thank you guys.
Yeah, thank you for sharing that, Maddie. I'm really sorry to hear that. I was really sad when I first heard about that, knowing the great support that you provide, you and your colleagues provide in that area for especially vulnerable families. So I'm
Yeah,
glad to hear that there won't be a gap in coverage. I hope that is accurate and continues to be um, true.
yeah, thank you.
Um, all right, Brittany.
Hi, everyone. My name is Brittany Regan Fisher, and I'm here in 2 capacities. The first and most important for you all is within Zip Milk, which is a project of the Mass Breastfeeding Coalition. And we are so excited, excuse me, to have Maine on there. I just wanted to give a little bit of a visual to what Kara was speaking on earlier. And what I am going to show you is just the general Zip Milk website. And if anyone's going on here and you're feeling overwhelmed with submitting a listing, or if you feel like there are changes, I just had Kara email me today, and there's one that I think I can do, and there's one that I'm not sure I can do, but always open to ideas. I am not an IBCLC myself. I'm a CLC and a CBS. But I also work at a DME, which is the next thing I'll chat about. But so for me, it's always helpful from private practice perspectives in hospital, to get those questions of, can we do this? Can we do that? But really, you'll see in here, it should be very easy to submit a listing. It is currently free, and it's always free for families. And you would just select which group you would want to post yourself within. And also note that if you sort of represent multiple categories, you can list within multiple categories. And then you would just fill out some information about yourself. The most important thing for any listings on ZipMilk is your description, and making sure that your contact information is correct. The description is really where you can describe who you are, how you support families, and, give people sort of that draw so that they click through to go to your information. The goal of ZipMilk is not for them to be on our website very long. The goal is for them to move on to the providers that can truly give them all the support that they need. I also wanted to show you really quickly, we have searching by the zip code itself. We have an advanced search and also a search by state. So when we go into Maine, it will automatically adjust the advanced search to stick within Maine, and they can select a listing category itself, as well as a radius to search from. It goes to 100 miles, not because, maybe they will drive. Maine is large, but for virtual support as well. We have languages available, and then we just added a search, a sort, so they can sort by, different features in here. And so if you have questions, if you have any thoughts, it is now able for people to put in an image, whether it's a logo or an image of yourself. So definitely feel free to put one of those in there. And again, reach out if you have any questions or any thoughts on making ZipMilk even better.
Thanks, Brittany. I have one question. If there's do you ever get requests from people who say that a category that the role that they're in wouldn't fit a category you have, or are you able to
Yeah,
find your
yeah.
category?
So we sometimes have people reach out where they're working in different capacities. So, for example, I'm a postpartum doula, but I have some sort of lactation certification that puts me in another category. If I were just a doula, not just a doula, doulas are amazing, but if I did not have a lactation certification along with being a doula, they wonder if there's a place for that. And it's been like a really fine line for us. Like we typically don't list DMEs. Like my other job is a Celeron. We don't list DMEs. We try to keep it very lactation focused, and within most certifications, everybody has a certification, like within different WIC supports or support groups. But yeah, we do have requests, and it's always something that we take in. And I'm not the only one that decides. I bring it to the entire board. I do sit on the board, so we meet monthly. So if you ever have suggestions or questions about that, please send them in. I did have somebody reach out last time about coordinating the WIC contacts, and I emailed them to meet, but I haven't heard back. So if you're on the meeting today, let's find a time.
Awesome.
Are there ones in particular you're thinking of, Kara?
No, I'm wondering if anyone on here is thinking, oh, I'd like to be listed, but I don't know which one I would fall under. I know we have a lot of home visitors here through the Maine Families program who are CLCs.
Mm-hmm.
And so I think that there's the CLC option that they could select, but I'm just wondering if there would be home visitor or something like that. But yeah, so if anyone here is thinking about something or have any questions about Zip Milk, then you can contact Brittany, and Brittany, put your contact info in the chat.
Yes,
that'd be great.
I will.
Brittany, I have a question. Just given that we've been on Zip Milk for a period of time, would you remind me what kind of controls folks have to actually update their listing if they have new contact info or additional offerings?
Absolutely. When somebody creates a listing, it has a 2-week approval time frame, just making sure we, in our world, we do have some spam. And so once it's approved, they will have access codes, and they can log in anytime to edit a listing. It did previously, this is a new change where it would have a 2-week time frame to be reapproved, but I did remove that reapproval. So if somebody's just editing a listing, it should be live right away. Make it a little easier on you all.
Thank you.
Of course. And then, Kara, would it be okay to switch over to my Acceleron thing really quickly? Awesome. So Acceleron is a DME that works in Maine, Mass, and all over. I'm actually located in North Andover, Massachusetts right now. But so we have it's not new anymore. It's been about a year, but we have a clinical series that we offer, and it's basically a free provider support group. So my role at Acceleron is our education and support programs manager, which basically means I'm not great at sales. I'm good at customer service, but I hate being behind just a computer by myself and looking at forms. But I love interacting with families, and I love interacting with providers. And we felt like a space that was sort of missing was we're offering support to families for free with some basic information. But we have people reaching out all the time in all of our states asking about different things for breast pumps. And since we're working with them directly, I have a little bit of way to disrupt the system a little bit with manufacturers and demand some things. I don't always get my way, but I do ask. And so again, this is just a free support group. It's monthly. It's either at 9:30 or 12. And the next one coming up in March is on flange fit. And we do talk about things generally, but also from a DME perspective. So when it comes to flange fit and things like that, I do try to stay within our capacity that we are not a lactation provider or seeing somebody in hospital at home, things like that. So we do try to keep it very, very, within our general lane. So I'll put the link to that if you want to come in. And again, any questions, let me know. Thanks, Kara. Thanks, everyone.
Thanks, Brittany.
Brittany, in the chat, somebody asked, do you have Acceleron rack cards in other languages?
We have English, Spanish, and Portuguese currently. And so outside of that, there are no other languages, but we do have availability for anybody that is putting an order in. If they are doing it with somebody, we see this at WIC a lot, where they'll put the order in and you can select a preferred language, and we will reach out to them in their preferred language with our translation service. So we're able to communicate in any language. The first step is just usually a little bit harder on practitioners because they're helping them fill out that form originally. We are working on getting our entire ordering set up to be done in English as well as Spanish. I'll put my email in the chat, Michelle, so that you can reach out anytime.
Awesome. Thanks, Brittany.
Feel free to spam us with email saying your ordering needs to be in Spanish and English. It needs to be translatable because it will give my say a little more oomph when it comes from everybody that's actually accessing it and working with families as well. So put us on the spot.
Awesome. See a thumbs up from Michelle. All right. What else?
Hi, Kara.
Hi, Cindy.
This is Cindy Grass. I'm the Public Health Nursing Supervisor for Maine CDC in the middle of the state, Penobscot, Piscataquis, and Hancock and Washington counties. I'm proud to say that we are, as of Monday, we'll be at full capacity for state of Maine nurses for the first time in a very long time. That's 50 nurses covering the entire state. So very exciting news for us. We have some wonderful people out there and doing some great work. I just wanted to tell everybody we've been doing this program, and we started doing it in the middle of the state. Now it's going down south and going up north, where we're collaborating and working with libraries to do baby and me groups, and they're going very well. One in Dover Foxcroft, the numbers are up to 16 now, which, if anybody knows where Dover Foxcroft is, it's just a small little town over in Piscataquis County, but going very well. So, and down in the southern region, they're seeing success there, and up in northern Maine, up in the county, they're seeing a lot of success there as well. Let me see, I'm looking for the date. We are having a presenter come in a couple of weeks, and Sarah Toohey is going to be coming to present to us on March the 24th, and we're really excited to have her come in. And other than, groups that are going on and partnerships that are going on with us, with Maine Families and WIC and Bangor Public Health, that's what's going on with us. And we're really excited about the work we're doing. And if there's any IBCLCs that are interested in, and having us have their names, so when we do need extra help, we can reach out to them. That would be greatly appreciated. We have an amazing one over in Dover Foxcroft. Her name is Jessica Thibodeau. And we also have one right over at Bangor Public Health, Sarah, that, we reach out to every once in a while too. So that's all I got for right now. Thank you.
Thank you, Cindy, for always being here and sharing those updates about the awesome collaboration that you're doing in your area. It's really great to hear about. I have a question that came through to us recently from the Maine Health Cancer Care Network. They're looking for, they said that their breast cancer surgical team is looking for education on lactation and wondering if we have any trainers who might be able to provide staff education. And that'd be great if someday we could have our own group of trainers that are always out there providing education to different programs. Right now, it's essentially our coalition of people who we can reach out to. So if you are someone who would be interested, I'm not exactly sure what specific education they're looking for. That would be the next question. But if you are close to the Maine Health Cancer Care Network, which I'm guessing might be located in the Portland area, but I'm not sure where exactly they're located. And this also might be something that could be done by Zoom. But if this is anything that interests you, please reach out to me and we can see who we have for potential trainers for topics like this.
Yeah, Kara, if you want to add me to that list, I'm definitely interested in learning more. I don't know if I'd necessarily be able to go to Portland regularly, but definitely an option.
Yeah, I'll find out more about what they're looking for. Thank you. And then I was attending the Safe Sleep Coalition meeting yesterday, and we were talking about resources that are available for families. And I had, mentioned again that breastfeeding is one way to reduce sudden infant death syndrome and let them know about our resource directories, the support groups, and um, in the Zip Milk directory, so that families, if they are having a hard time with breastfeeding and balancing breastfeeding with safe sleep, then they know that there are people that they could reach out to. Um, Hopefully, they're also getting that support from public health nursing and Maine Families and WIC as well. But we want to make sure that those resources are available if they happen to be on the Safe Sleep website. And they reminded me that there is a handout that is, I just had it up, about breastfeeding and safe sleep and asked if I had any feedback on it. And I do have some thoughts, but I'm wondering if there's anyone here who also would have an interest in reviewing this document. I'm going to put it in the chat. And maybe working together to offer some suggestions for edits. It sounds like now is a good time for them to be making some edits. So I consider this a really great opportunity. I know that this can be a really tough topic, and it's one where we want to make sure we're providing evidence-based recommendations all around. And we also want to make sure that families are feeling supported in their desires to breastfeed and their desires to make sure that their baby's safe, of course. So, if you have any interest in sharing, you're welcome to just email me thoughts or feedback, or this could end up being the type of thing where we create a small work group to do this. I would really love to have parent feedback on this handout as well. And so I thought I'd open that up to this group. If anyone else has an interest in this, I'd be happy to work with you on it. All right. Who else has something? I'll start calling on people. Any updates at WIC? I'm seeing Michelle and Ariana here and other folks from WIC. I'm seeing some folks who I've seen signed up for focus groups, which is awesome. I'm really looking forward to that. And again, please, if you can join a focus group, would love to see you there. Or if you know anyone who would be great for these focus groups, let me know. Pass it along. Michelle, I see you're
Say hi.
unmuted. Yeah.
Yeah. I'm just saying hi. I'm Michelle Segovius. I'm the lactation coordinator here at the Cumberland County WIC program. I wanted to share that we hired a new breastfeeding peer counselor this winter, and her name is Nicole Inez, and she is our multilingual breastfeeding peer counselor. So she's been doing a great job, jumped right in, and she's a lovely part of our team. Hoping she'll be able to join this meeting next month. And I don't think I have any other updates at this time. I know we have a bunch of collaborations and ways to continue to support the community in the works, but nothing sort of nailed down at this time.
Awesome. Thank you, Michelle. Michelle, I think you and Ivory both put in the name of that book again. I don't know if you want to say anything more about that, about the DEI committee or about the book.
No, I haven't started reading it. We're going to discuss the beginning of it next week, so I've got it on my nightside table. But yeah, we're looking forward to learning more. I believe, and Ivory, you can correct me if I'm wrong, about a transgender parent, sort of discussing their experience with having birthed the child and breastfed as well.
And that is called Where's the Mother? Awesome. Thank you. Katie, I think I saw Katie Reed on here. Is Katie here? Katie, is there anything you want to add about paid leave? You know, if you're available.
Hi, yeah, I can come off mute. Hi, thank you, Kira. Yeah, I don't have much new things to add. Contributions have started, and the Paid Leave Authority, which is the oversight group, met at the end of February and took public comments from folks about how that program has been going. And the Maine Department of Labor has also released approved private plans for folks who are choosing to take on a fully insured private plan that's not the state option. And they have some resources on their website for that. And then payments will be due from employers for those contributions by the end of February or end of April. I'm sorry. So that's we're still moving in the same direction. And there are a lot of bills about paid family medical leave, some of them just technical changes, and then some of them trying to undermine the program as a whole. So we're still working on the Paid Leave Coalition is still working on advocacy about the importance of paid family medical leave. And yeah, so that's kind of where we're at with that.
Okay. Thank you, Katie. Does anyone have any questions for Katie about paid leave? Yesterday, the Paid Leave Coalition met and we had a report out from the Maple study. I know that I had sent out in newsletters and shared in this meeting before about that survey that they were doing to look into the impacts of paid leave on new parents and new families, or the impacts of not having paid leave. And so they've reported out on that, and maybe the next meeting they could report out for us a little bit more about that, more specific to the breastfeeding questions. There were definitely a lot of connections to breastfeeding experiences in paid leave they mentioned in their results. And yeah, and then the next meeting I attended was that Safe Sleep. It's, I think, Infant Safe Sleep and Abusive Head Trauma Prevention Coalition. And they had a presenter from oh, Katie, what was the organization? I told you, the National, oh, shoot, like Child Abuse Prevention, the national chapter of this Child Abuse Prevention organization. And she was
Prevent Child Abuse America.
Okay, thank you. And she ended up speaking a lot about paid leave and the impact on child welfare, essentially, related to paid leave. So many good reasons to support this. And again, if you have any questions about how this would impact you or your employer, feel free to reach out to Katie.
I'm also going to put in the chat a link to our to an event, a webinar we're doing. It's a free webinar, and it's going to be presented by the National Partnership for Women and Families, and they put together this policy document in all states about the network of policies that affect women and families, like paid family medical leave, and paid sick and safe days, covering doula care and insurance, stuff like that. So it's like right up what you guys talk about. And so it'll be nice to hear sort of how Maine looks in the greater in the country, compares all of those. So
Thank you, Katie. Looks like a great resource. And Kim, thank you for sharing in the chat about a resource, some Zoom groups that are available for families who may be affected by the ICE involvement to help teach them their rights, and the info may interest providers serving those communities. That's great. So that information, is that only available on Facebook, on a Facebook group, Kim?
I'm seeing them on Facebook. That one specifically is from the Brazelton Touchpoints Center, which is a reliable source of information, and they're huge advocates for all cultures and communities. I've been seeing other agencies posting as well, but these are the ones that I know of. In my in wearing my other hat as a secretary for the Military Support Network, talking with some local legislators recently, their call volume is incredibly high right now for reasons, but they are encouraging people to continue to call, continue to ask questions, in supporting themselves and supporting their clients, in trying to make sense of what are actual policies that are passing and what are just policies that are being spoken about, because there's a big difference.
Mhm.
So they're encouraging people to continue to call your local legislator, share your thoughts, concerns.
Great. Thank you, Kim. Yeah, it's true. There's a lot of information that's out there right now that's not all accurate, or yeah, so it's a lot to sort through. And thank you all for staying updated as you can, and finding resources to share with families so that they can feel safe. All right, any other updates or questions? If anything comes up for you, know that you can reach out to us at any time, info@mainebreastfeeds.org or director@mainebreastfeeds.org. Um, and otherwise, thank you for all the work that you do every day and for being here today. And enjoy the rest of your day.